This is the Nutrible MD Podcast. Good to have you here again. I'm your host, Dr. Brandon Lip. If you are seeking wellness, happiness, and balance in your life, you are in the right place because all of the original content is designed to expand your horizons in an unconventional way. I incorporate all my clinical knowledge from my father's 50 plus years of experience and my own 25 plus years of helping people with various needs. This is part 2 of Sensitization, Predisposes After Effects. We are going to dive right into the actual clinical scenarios involving COVID and post-COVID patients. I am sure you will learn a lot from all of my experiences. Let's begin. Here is the first real patient encounter. A 31-year-old female who is diabetic has a confirmed COVID infection. Her husband and her son are also infected, but her daughter remains symptom-free and is COVID negative with repeated testing. So what can we glean from this case? I am pretty sure you have also seen the same phenomenon happen in some friends and family. Someone catches COVID and the entire family gets exposed repeatedly. However, a member of that family doesn't really get infected, or at least develop any noticeable symptoms. So what's happening here? There is now research providing data that is pointing to the HLA genes. HLA stands for human leukocyte antigens. It appears that the HLA genes are involved, at least partly, in the susceptibility and severity of the disease from a COVID infection. However, like I discussed in part 1 of this series, the susceptibility does not necessarily equate to the quote-unquote strength of the immune system. It just means that with COVID infections, the HLA genes do play a role in influencing the susceptibility and severity of the disease. With other viruses, more research is needed to see if the same occurs and to what degree. One thing that we do know for sure is that many chronic health conditions increase the risk of getting infections, including COVID. The next patient scenario. A 29-year-old male had a COVID infection 4 months ago. He recovered well from the initial symptoms. He has never had issues with allergies, seasonal or otherwise. However, this year he is having significant problems with sneezing, itchy eyes, runny nose, and nasal congestion. It is obvious that he is having a hard time with allergies this year when he has never had such problems ever before. So what is happening here? What we are witnessing is the complex relationship between allergies and the immune system. Allergies, whether it's seasonal allergies or chronic year-round allergies, stem from an overreaction by the immune system. Triggers are causing the immune system to release histamines and other biochemicals in a way that is more than adequate. The same types of reactions that would occur to fight off an infection are being directed to environmental antigens, causing all kinds of undesirable symptoms: watery eyes, plugged up nose, sneezing, and even wheezing and trouble breathing when it's more severe, when the airways actually close down, resulting in bronchoconstriction. That's why people who have asthma are very susceptible to allergens in the air. For example, smoke from wildfires. In conventional medicine, we resort to antihistamines like cetirizine, which is Zyrtec, loratadine, which is Claritin, Allegra, also known as fexofenadine, Benadryl, which is diphenhydramine, and nasal steroids like Flonase, fluticasone, budesonide, Nasacort, and even non-steroids like azolastine. Many times they do work well, but they only control the symptoms. For some people, they may have even gotten to the point where these medications have stopped working. No matter the situation, in conventional medicine, the mainstay is to control the symptoms. There are situations where the allergies or asthma is so bad that the allergist would need to use immunotherapy, also known as allergy shots. Immunotherapy is conventional medicine's way to desensitize the immune system and to build up some tolerance. Usually, it's 2 shots per week every week for months to years. The allergist starts off with the lowest dose of the allergens and ramps up the amount your body is exposed to little by little until a maintenance dose is achieved. At that time, depending on your clinical stability, the timing of the shots can vary from the initial sets, hopefully just 1 time a month. With this modality, many patients do have better control of their symptoms, but as you can see, it is very time consuming and costly because it involves getting shots 2 times per week every week for quite a long time. In my private practice, I offer an alternative. In Chinese medicine, we have known for a long time that there are herbs that can help desensitize the immune system. I use combinations of these herbs tailored to the individual, and often in less than 6 months, their allergies are much better, with a declining need to rely on the herbs to get the same effect. The great thing also with using the Chinese medicine method is that we do not only treat the symptoms associated with the eyes and the airways, but also all other organ systems involved. Many people have skin sensitivity issues or digestion issues associated with an overactive immune system. This can appear in the form of hives, itchy red spots, or rashes that just won't go away completely. Some people experience loose stools, cramps, excessive gas and bloating, with or without specific food triggers. These are all addressed by the use of Chinese herbs. Let's introduce the third patient scenario. A 48-year-old male noticed that ever since he had his COVID infection, he has been having brain fog and continuing fatigue. These symptoms are often very debilitating. But what's interesting is that the related COVID infection did not necessarily have to be severe. It could have been experienced as a minor cold only. What we do know also is that those with pre existing chronic medical conditions have a higher chance of developing brain fog and fatigue. These conditions can be common ones like high blood sugar, high blood pressure, asthma, chronic pain, thyroid disorder, obesity, prior heart attack or stroke, and many more. From a Chinese medicine point of view, this makes total sense because we know that each organ system in the body is intimately connected with each other. When one system is under stress, it weakens all the rest sooner or later. That's why when we integrate a holistic point of view to conventional medicine, we can help our patients with a wider range of tools. With scientific research, we focus on the fine details when necessary to understand the individual mechanisms better. For example, scientists have discovered the presence of autoantibodies in the cerebral spinal fluid of those with brain fog or other types of cognitive symptoms. This is groundbreaking evidence that autoantibodies do play a role in creating abnormalities long after the actual infection is over. These autoantibodies can attack any part of the body depending on their preference and their specificity. For example, if these autoantibodies attack thyroid related functions, fatigue can easily be one of the symptoms to appear. I believe that in the near future, with quantum computing, researchers will be able to match which autoantibodies do what types of damage, and once we have this critical information, a better roadmap to treatments would emerge. Moving on to the fourth patient scenario. A 28-year-old female noticed that soon after getting her COVID vaccine, she started noticing irregularity of her menstrual cycles. This is a phenomenon well noted in conventional medicine because it has been widely observed all over the world. But why does it happen? Although the menstrual cycle can be shortened or lengthened, for most women, the period is delayed. We don't know the mechanism yet from the scientific point of view, but Chinese medicine can actually offer an elegant explanation right now. During a woman's menstrual cycle, yin and yang phases occur correlating with the hormones involved. Chinese medicine explains that in order for a period to occur, A transition from the yang phase to the yin phase must transpire. In conventional medicine, before ovulation, it is the follicular phase, and this is when the uterine lining begins to thicken. After ovulation, it is the luteal phase. Without going into a lengthy explanation of yin and yang correlations with the different hormones, I can tell you that the follicular phase is a yin phase and the luteal phase is a yang phase. When the estrogen and progesterone levels drop as the end of the cycle approaches, this is the transition from the yang to the yin phase. In Chinese medicine, the COVID virus and COVID vaccines are considered to be a type of yang influence. When a woman becomes pregnant and stays pregnant, this is a yang phenomenon. Thus, when a woman is administered a COVID vaccine, the body is tricked by this yang influence, making it analogous to being in a pregnant state. The yang to yin phase transition does not occur yet. So what happens? The period is delayed. But since the woman is not truly pregnant, the body finally realizes this and the period kicks in eventually. The exact biochemical correlations will need to be elucidated and confirmed by scientific research. But this Chinese medicine explanation serves as a perfect foundation to guide this investigation. Now, finally, the last patient scenario. A 34-year-old female has a chronic cough ever since her COVID infection. Her chest x-rays are normal and she has no history of asthma. One thing I have noticed that many patients have reported is that the mucus produced by a COVID infection has a gel-like consistency. It is a lot stickier compared to the mucus from infections caused by other viruses. I see this as one of the main reasons why chronic cough can occur quite often after a COVID infection. The more than usual stickiness of the mucus and phlegm causes prolonged irritation of the airways, and the longer the irritation, the longer the cough lasts. It also explains why many of the popular over-the-counter medicines like guaifenesin, Robitussin DM, Mucinex DM, Delsym, dextromethorphan, Dayquil, NyQuil, and many others do not work as well. Even prescription medications like promethazine DM or narcotic cough suppressants also do not work as well. Nevertheless, I have found a great combination of medications to treat chronic cough. This combination is benzonatate, brand name is Tessalon Pearls, plus a steroid inhaler like beclomethasone, fluticasone, or budesonide. The most ideal inhaler to use is definitely not albuterol, but Symbicort, which is budesonide and formoterol combined. Formoterol is a long-acting bronchodilator. It opens up the airways to allow more airflow. Albuterol, on the other hand, is short-acting, but is still being prescribed by many healthcare providers, and this needs to stop because it has no valid role anymore in treatment of chronic cough or asthma according to the latest clinical guidelines. By using benzonatate plus the budesonide/formoterol inhaler, stopping chronic cough is much more likely. Since many people will get better with this regimen, where does Chinese herbal therapy come in? Since I combine both disciplines, my protocol is to start with the conventional medical therapy first, and then if I notice that the patient has a recurrent pattern of having chronic cough relatively easily, then I would use Chinese herbal medicine for desensitization. If these dragged on coughing episodes are happening more than 2 times per year, I would start the Chinese herbal therapy for sure. This concludes part 2 of the Sensitization Predisposes After Effects lecture series. In part 3, we will go through some quick learning points, some discussion of long COVID from a different perspective, and my final thoughts. I invite you to step out of the box and look at all aspects in your daily life never addressed before, because the answer you've been searching for could literally be right in front of you. With what you learn from my podcasts, you will develop the knowledge and the courage to face those health dilemmas and be the best version of you. Please subscribe and let me know what you would like to learn about, and I will do my best to provide you with the most practical and original content from all my experiences. Know that faith and fate are powerful, but you choose your destiny. Until next time.